My name is Bamidele Osamika. I'm the Regional Climate Collaborative Manager at Green Umbrella. Green Umbrella is a regional climate collaborative for Greater Cincinnati. We have been serving as a backbone for environmental and sustainability work in Greater Cincinnati for 25 years. Over the years, we've connected hundreds of members, including academic institutions, businesses, non-profit, as well as and local government, as well as passionate individuals through our collective impact approach to tackling the most complex and complex environmental challenges our community faces. Next slide. This webinar is titled Climate Change, Allergies, and Health Outcomes in Greater Cincinnati. This 1-hour webinar hopes to explore the connections between climate change, several types of allergies, and our health outcomes in Greater Cincinnati. Our panelists will make a brief presentation, followed by the Q&A, and then we'll wrap up with next steps and some announcement. With the recent change in Green Umbrella identity from Regional Sustainability Alliance to Regional Climate Collaborative, Green Umbrella joins more than 30 other climate collaboratives across the country, all of them working on cross-jurisdictional climate action and giving our staff and existing programs and a partnership that we have established over the past 25 years. Green Umbrella is now actually the largest regional climate collaborative in the country. Green Umbrella serves the Tenkari region across Southwest Ohio, Southeast Indiana, and northern Kentucky. Myself, Nobi Kennedy, who is our regional climate collaborative coordinator, and Van Sullivan, our senior director of programs and climate strategy, are the 3 primary staff members supporting our climate health equity work. Alongside with us, we have our climate health fellows, Mitch Singstock, who is a 4th-year medical student at University of Cincinnati Medical School, and Leas Rose, who is an undergraduate medical student at University of Cincinnati. This climate health webinar series builds on a recently completed report that was done in partnership with Scioto Analysis. This highlights the findings of this report and accelerate actions on key related issues. We have released a public service announcement toolkit connected to these topics that's going to be covered in this webinar series. And also, you can please visit our website and other social media platform and read to download the report in full. The public service announcement covers 11 climate health topics, 1 per month. Today's webinar is the 8th in the series. This campaign provides data and shareable media materials every month. Also, this campaign shares actionable strategies at the individual, institutional, and system levels. This month, public service announcement campaign covers climate change, allergies, and health outcomes in Greater Cincinnati. Did you know that climate change has increased pollen production, which poses serious health complications for communities? In Southwest Ohio, ragweed pollen is a major cause of seasonal allergies. Ragweed begins pollinating in August. The peaks of it is in mid-September and lingers till November. It is crucial for us to know that pollen spreads easily and widely. It triggers several allergies, including nasal allergies and allergic asthma. It becomes worse for individuals who are vulnerable to respiratory illnesses, especially in children, women, and as well as those who live in low-income communities. Then what can you do? What can institutions do? We can all improve our air quality by keeping indoor air clean, monitor pollen counts, and many others. Our institutions can invest in health and housing infrastructures, in transitioning to renewable energy. At this juncture, I'd like to introduce our guest speaker, who is going to dissect this topic and be ready to provide an answers to a few questions we'll be asking later in the presentation. Our panelist is Dr. Michael Sherenian. Michael is a clinician scientist at Cincinnati Children's Hospital Medical Center within the Division of Asthma Research. He's a board-certified pediatrics, allergy, and immunology. His research focuses on allergic diseases development in children. Please join me in welcoming Dr. Michael for his presentation.
Hello, thank you for having me. And thank you for the introduction. So, like Bamidele was saying, I think it's important to understand and take a step back and look at what allergies are and what allergens cause allergies. And so that's the first part of the topic that we'll talk about today. Next slide. So there's three big classes of allergies that we think about when I see somebody in the clinic for allergies or when we research. The first are pollen allergies. These include broad categories of grass pollens, which you can see listed here, includes several different varieties. And one of the obvious ones that's important in our area is actually Kentucky blue, because we're right next to Kentucky, and Kentucky bluegrass is very prevalent, as well as some of the other ones with rye, sweet vernal, and golf courses actually have Bermuda grass. And so if you live near a golf course, you might have Bermuda pollen, or a lot of golf courses do. Weeds that are important, ragweed is probably one of the most important allergens, as it was said earlier. And you can actually see ragweed in the picture. It's one of the spiky ones. That you'll see on the left-hand side of the different pollen allergens. And then trees. Tree allergens include oak, cedar, birch, and adler. Those are the main pollens that are found in this area of the country. And again, on the left-hand side is just a schematic or an electron microscope scan of different pollen allergies or different pollens. Next slide. And next up, we have the mold allergens. And the mold allergens are Alternaria, which is what you see on the left, Aspergillus, Cladosporium, and penicillin. And interestingly, these mold allergens, when we think about respiratory disease in particular, pollen allergens, mold allergens, and the indoor allergens, which we'll talk about next, all can affect respiratory disease and upper airway, which is your typical allergy seasonal symptoms with runny nose, itchy eyes, sneezing, congestion. But really, the mold allergens seem to have some of the most biggest impact on the lung allergy diseases, so asthma in particular, where if you have Alternaria allergies, you actually have a much increased chance of having hospitalization or an asthma exacerbation if you're exposed to these. Next slide. The indoor allergens constitute three main allergens: cockroach, two different types of cockroach, dust mites, also two different types, and then mouse. And when we think about these allergens, as was said, there's a temporality to them of when they are most prevalent. So indoor allergens are most prevalent during the winter months because you're inside more often, and these animals also tend to migrate inside. So mice are coming in from the cold, as are the cockroaches, and dust mites live on your pillows and sheets and proliferate more when you're around pillows, couches, things like this more, which means that they are more likely to affect people at that time. spring pollens tend to be, just backing up a second, tend to be trees, followed by grasses, and then weeds, including ragweed. Molds or any wet time of the year are problematic for people, which becomes more relevant as we talk about climate change in a few later slides. And in Cincinnati, we're in a unique position because the city itself sits in a valley, which means that during each of these seasons, the molds and pollens will settle within the valley and just stagnate there and end up congregating and causing more problems with higher concentrations. Next slide. This is a very detailed schematic, which is definitely not for the scope of this presentation, but I put it in here just to give perspective as of the cell coordination and all the different processes that happen when you are exposed to an allergen. So I'll highlight the very top of this in particular, which when we think about an allergy and how allergies develop, there is a barrier problem or barrier dysfunction where the allergen or the thing that is causing the allergies get into the bloodstream and past your barrier, which is your skin cells or the lining of the inside of your nose or your respiratory tract, including your lungs. And then it causes an inflammation cascade process that then triggers multiple cell types that gets you to gets you to have the allergy. But then once you have the allergy, causes those symptoms that you see in the lower right-hand corner. Of again, the itching, sneezing, runny nose, and congestion, which is basically just your blood vessels getting swollen and causing blockage. Next slide. So how does climate change impact different allergens? And this is where we'll break down into how the different aspects of climate change are impacting allergens, including the moles and the pollens. Next slide. So on the right is actually a picture of ragweed and what it looks like just in the environment, not under a microscope. And there's a few different aspects of how climate change is impacting pollen allergens. Most importantly, it's leading these plants to produce higher concentrations. Plants like increased sun, they like warmer weather. When it hits frost, we actually will typically tell people, you might actually be able to stop using your allergy medicines because the frost kills most of these pollinating plants. But when we have longer periods between frost or regions that used to have frost but no longer have a frosting period, these plants just never die and keep producing and growing, and each individual plant produces higher concentrations. Again, those longer seasons with warmer weather leads these plants to have a longer growing time. So not only are they producing higher concentrations per plant, they are growing for a lot longer time, giving the time temporality longer. And then also each individual plant, as I said, produces more pollen allergy or more pollens that can cause allergies. And there are several studies, and I didn't include them in here, that show that each allergen is actually more potent, where the allergen itself elicits a stronger response in the body when it comes into contact with somebody who's allergic to it, which is becoming a unique phenomenon. And there's also changes to the flowering season. So some plants will now have multiple flowering seasons, which produce pollens that can cause allergies. And again, like the other ones, they tend to be longer now. Next slide. So here is some data that is, again, just discrete graphs showing that rising temperatures are associated with the increased pollen counts. This was a study that was published in The Lancet that looks at European, East Asian, as well as US sites, and depicts pollen counts and temperature increase. So on figures A and B, the x-axis for both of these are slope of cumulative temperature increase, so rise in temperature, and on the y-axis you have the change in pollen load per year. And the A is looking at the maximum temperature, so the T max, and then B is the T min. So in A, in both of these, you can see that with increases in the highest maximum temperature for each of those over time, you have an increase in pollen load per year. And the same thing happens when you have a higher minimum temperature, you're increasing your pollen load over time. In E and F, these figures are depicting frost-free days per year. And in E, the x-axis again is frost-free days per year, so days that these plants can produce pollen. And on the y-axis, you see an increased pollen load per year, and there's a direct correlation where the increased number of frost-free days per year, you have an increased amount of pollen that is produced per year. And in figure F, the y-axis is the pollen season duration per year. So it's again days. So increase in pollen season duration. And you see that there is an increase in pollen season duration as days per year that is also directly associated with frost-free days per year. So overall, all of these figures are showing that as the seasons get warmer and there are more frost-free days per year, there's more pollen that's produced, and the duration of the seasons that the pollen is produced is longer. Next slide. This is looking at change. These figures are all looking at changes in pollen over time now, from 1990 to 2020. So over the course of 30 years in various European cities where a lot of this data has come from. And so here they're looking at hazel pollen, which tree was a tree, birch pollen, another tree, and then cumulative grass pollens. And you can see that the onset of pollen production has decreased. So in the first row, has decreased from the beginning of the year, starting in 1990 to 2020. So pollen is starting to be produced faster from each of these different types of pollens at the beginning of the year than it had been in 1990. You can also see in the second row that the duration of pollen production is increasing or has increased from 1990 through 2020. And that holds true again for hazel. Birch is more stable, but then also grass, more pollen producing days per year. And then the final is the amount of pollen produced per day from this time period as well. And again, you see this increasing trend of pollen that is produced per day in each of these different cities. Next slide. More locally, this was one of the only things that I could find that was produced out of this country was increased tree pollen counts of North Carolina, and I thought this depicted it well. And it shows in April 6th that the previous 2010 record pollen count was just over 10,000, but you can see that there was a trend increase, and in March 31st of 2024, there was over a 50% increase in pollen count that occurred from trees alone in North Carolina. Again, lending evidence to the fact that we are seeing increased pollen counts that are associated over time, which had typically not been seen in the past and associated with climate change. Next slide. This figure is a paper that was published in PLOS One and looked at the predicted distribution of ragweed in 2050. So on the left-hand side, you can see the current distribution of ragweed in black and how many kilometers it impacts. And on the right-hand side of this figure, you can see that the future predicted coverage area of ragweed is much broader than it had been. And the numbers, the 4.5 and the 8.5 are not relevant for this conversation, but you can see that there is a large area, particularly in the Midwest where we are located, that ragweed is going to be much more prevalent than it has been. And as Bamidele had said, these pollens do travel quite a long distance But there is a dispersion effect. So while we actually say you can test for pollens that are found in the United States and in England and in Europe, but there is a higher concentration of those pollens in this area. So if you're living in an area that has a increasing concentration of ragweed and you have a ragweed allergy, you're more likely to suffer from ragweed allergy symptoms at that time. And it looks like, based off this predictive model, that is going to continue to increase through 2050. Next slide. And so how does pollution impact pollen allergenicity? And I believe Dr. Ryan spoke last month all about pollution. Pollution impacts or increases the allergenicity of pollen. And they actually interact with the pollen particles to reach lower airways. So what you can see on the right-hand side is a picture, like a really zoomed in picture of pollen with different particulate matter on top of it. And that is all, I believe this is PM 2.5, where it's the particulate matter that is associated with diesel exhaust. And it is latching on or sticking onto the pollens. And pollens themselves are pretty sticky, but it actually increases the stickiness factor of the pollen. And so what happens is you breathe in this pollen, it gets further into your airways because it can travel further and because of different immune mechanisms, and then it has a direct irritant effect on the airway and the disease. So pollen themselves are irritating, the pollution is irritating, and they have a magnified effect, we think, on the airway irritation when they get down into the lungs. And the pollution in and of itself is thought to help those pollens migrate further into the lung tissue and the airway tissue than each one independently would, which is what was seen. That, if you remember back to the figure where I showed the immune mechanisms of allergen in the airway, that is what this is impacting, which is not only causing people to have more severe symptoms if they have allergies, but because it is facilitating the allergen getting past the airway barrier, will cause more people to end up developing allergies as well. Next slide. So now the impact of mold on allergens. So that was all about pollens. Now we're shifting to molds. This black mold is actually mold that most people will think of when they think of mold in homes. It's cladosporium. It is very associated with, again, airway disease. In this concentration, it will assuredly have an impact, not just on people who have allergies, but in high enough or have known sensitization to and the propensity to develop allergy symptoms. But anybody, if there's concentrations of this degree in a home, will have symptoms with exposure. And the same actually goes for pollen too. It can be so irritating in such high enough concentrations that even without having the allergy sensitization, meaning your body produces antibodies to the allergen, you can end up developing symptoms. So the broad-based climate change impacts on mold allergens are very similar to what we see with pollen allergens. You have increased mold development, you have longer mold duration, the mold is more potent, and you have increased mold concentrations. But mold, unlike the grass, weed, and tree pollen allergens, mold is very susceptible to wet environments, right? You see mold growing, it's in damp situations. And the factors of climate change that impact mold allergens are more related to weather events, which we'll get to, where you have more thunderstorms, you have more rain, you have longer seasons of like monsoon seasons and more tropical climates. They will see increased mold development in those areas. Next slide. And that's what this figure is showing. So the top left corner starts in 1973 and then gets to 1991, 2007, and then 2017. And that you can see from 1991, And on the scale, so if you go from the browner areas, there is increased humidity. With the bluer areas, there's less, or a change in humidity, and you can see that over time there has been an increase in relative humidity um, uh, across the globe. And so um, there are changes in humidity. So areas that are less humid actually are getting less humid, and areas that are more humid are getting more humid. So it's a amplifying effect, what we see with humidity. Next slide. So what sort of events am I talking about? So one, to start with, hurricanes and cyclones. We see with climate change increases in frequency of hurricanes and cyclones. So this will lead to increased frequency of flooding of areas, which leads to increased moisture and dampness, such as water, which includes water intrusion into homes and floods. And these events also lead to increases not just in mold, but also into house dust mites, because they also really enjoy those damp areas. And house dust mites in particular, and mold, are very sensitive to microenvironment modifications, which we see in these events. We also see sensitization to both have increased in subtropical and tropical areas, likely due to that increase in concentration that's happening. And also, cockroaches and rodents will migrate indoors with increased flooding, because they're trying to get away from that water too. So they end up coming indoors and spending more time around people, which can increase sensitization in people who are susceptible, who are to develop allergies. Next slide. Thunderstorms have also increased in frequency and intensity. And I'll talk, I think, about thunderstorm asthma in the next slide, but it is a particularly relevant phenomenon. Pollen seasons will worsen in thunderstorms. There's increases in concentration of pollen grains, and the pollen grains themselves will get bigger, they get hydrated more, and then there's an increased rupture of pollens because of the thunderstorms. It actually happens in part because of lightning strikes down, which rupture large swaths of pollen. And these, again, pollen grains are grasses and weeds that are particularly affected. Thunderstorms are also associated with alternaria and cladosporium. Cladosporium being that one that is that black mold that I showed in the picture, and then also alternaria is the one that's really associated with asthma. And thunderstorms will also trap diesel exhaust particles and transport them. So what they do is at the head of the thunderstorm, or the leading edge of the thunderstorm, they trap these pollens and exhaust particles and migrate them along with the thunderstorm movement as well. Next slide. And that's what this figure is showing. And this is where thunderstorm asthma comes in. So on the left-hand side, you see a pictograph of a thunderstorm and how it interacts with pollens and pollen fragments. So you can see that the thunderstorm is formed, and you have rainfall. And with the direction of movement, there is the leading edge where pollens, because of the wind and the changes in pressure, are brought up into the thunderstorm and move at the leading edge and get pushed along with the thunderstorm, and allows them to travel long distances. Thunderstorm asthma is a particularly unique phenomenon, which the example that we always use in allergy is Melbourne in 2016, where it was the largest epidemic thunderstorm asthma episode. And what happened was there was this massive thunderstorm that occurred, and the lightning strikes were causing plumes of allergens to occur outside of Melbourne, which led to thousands of people needing to be admitted for asthma all at once. And as we have increases in thunderstorm events, these things are only going to be more and more common. And this has happened in the United States as well, particularly in Kansas and other areas throughout the Midwest, where thunderstorms and tornadoes and weather events like that are prevalent. Next slide. So this is just putting it all together. And I particularly like this slide. It shows that the feedback loop and accelerated changes of climate change. So at the top of the pyramid, you see burning fossil fuels, increased greenhouse gases, Elevated global sea temperature is contributing to climate change, which causes more environmental changes and extreme weather events like the floods and hurricanes we talked about. I didn't touch on dust storms because it relates more towards like environmental pollution, but that also impacts things and how airway disease develops, as well as increased temperature and heat waves. Then you see effects because of these on environment and air quality, such as extended pollen seasons and extended mold and dust mite seasons and thunderstorms. And again, all of these things interact with each other. The discussions that Dr. Ryan had last week and the other presenters interact with allergy and the development of allergies and how they the allergy pollens are then produced. And then finally, this all leads to increases in risk for asthma, pollen allergenicity, and allergic sensitization, and really just broad-based immune modulation. Next slide. So what management strategies can we talk about for helping to mitigate some of these effects? Next slide. So these are the personal level management strategies, which are very helpful. So if somebody has symptoms of allergies or has asthma or symptoms related to asthma, it's always important to make sure that they get evaluated by a medical provider, whether that's an allergist like myself, or pulmonologist, or their general practitioner, pediatrician, internist, whomever, family medicine doctor, to make sure that if they are having symptoms, they are appropriately controlled and that an appropriate plan is set into place. And so there are things like asthma action plans that if you have asthma, get provided to make sure that the person knows what the best plan for them is if they start having symptoms, to help stop the symptoms and treat them before they get out of control. Same thing can occur with allergic rhinitis or seasonal allergies or hay fever, all the same thing. To be able to make sure that those individuals, again, have a plan in place to treat the symptoms before they get too burdensome and it becomes an emergency. Minimizing exposures is also helpful to the allergens. This includes environmental factor or techniques or tactics like closing windows, avoiding parks during peak pollen season, avoiding traveling during peak commuting times or other high allergen times. And I'm not trying to say that these things are easy to do and that everyone can do them, right? It is very difficult for a lot of people to avoid during peak commuting times. They're peak commuting times for a reason. And people need to have places outside that they can go to. And some people don't have air conditioning and aren't able to close their windows and need those things, again, with climate change and increasing temperatures, to be able to have those windows open and to ventilate their home. So I'm not suggesting that everyone can do this and that they are easy solutions on the individual level. And frankly, that's probably not where most of these changes are going to the most impactful changes are going to happen. But then also when pollen levels are high, N95 masks can be helpful. Even if you're commuting during peak hours, driving with windows closed, making sure your car air filtration systems are regularly maintained and changing them out so that they are effective. Indoor air purifiers can also help. And they don't have to be expensive ones. They just have to be ones that have HEPA filters in them. And then avoiding, again, outdoor activities when pollen levels are high, if possible. Next slide. But more importantly, at the community level and the government level, these are other things that should be considered. So urban planning of walking and cycling paths that are separated from streets. As I said, those particles for diesel particles, they travel, but they are, as Dr. Ryan, I'm sure, told you, very concentrated around streets and highways and major thoroughfares. So having walking areas which allow people to get outside and parks that are away from those streets help mitigate that combined effect that I showed of the pollens interacting with the pollution and causing them to be more allergenic. Adding more green space, again, away from industrial areas and traffic arteries, will also help. And building protection from severe weather events. As we know, there's increased moisture and increased rain and surface water, and making sure buildings are well sealed so that water does not get in during these events. And at the government level, monitoring allergens and informing public the public on high levels of allergens. There are apps that you can buy that will notify you of high allergen days. And I know I tell people in my clinic, if they are particularly susceptible to one or two or three or any number of allergens, that having those will help inform them better on days they just need to be a little bit more cautious about the activities that they do. Control the release of particulate matter from industrial and vehicle sources. This is, again, a government level thing that can be instituted at the national or the state and local levels to help mitigate that combined effect that we are talking about. And again, reducing reliance on fossil fuels. A lot of the allergens are going to be there, right? It depends on the concentration that climate change is occurring, but really the root cause of this is the reliance on fossil fuels that we have that is increasing the downstream effect of the allergens. So all of the allergen mitigation factors are band-aids to the real solution. So next slide. Yeah, questions and answers. I guess that's it.
All right. Thank you, Dr. Mike. I really appreciate those information. They are very, very helpful to us and all the audience. At this time, we want to ask questions from our panelists. I will also ask the audience, so in case you have questions, please just type it inside the chat room, or you can unmute yourself at any time of this session to kind of ask your question. So please just drop that and let us know. So the first question I'm going to start with, we just have like a couple of questions here. The first one is, how do these allergies impact health outcomes of the vulnerable population in our region?
So I think that there's several ways that it impacts vulnerable population. One, vulnerable populations, and by vulnerable population, I'm referring to like the inner city population in Cincinnati itself, because Cincinnati as a whole is a vulnerable population because of its situation, but most inner city populations, even particularly in Cincinnati, live in older homes that are not as well insulated from those environmental fluctuations. So they might not have air conditioning. They might have increased mold because they don't have the protections that need to be taken to prevent water damage from coming into the home. There is, with increased symptoms and with increased disease, they need to be treated, and healthcare access is a problem. And getting to see an allergist to be able to help advise on some of these effects of the climate change impacts on allergies is harder for vulnerable populations to get to be able to do. Yeah.
All right. Thank you. So, second question here is, what holistic approach would you suggest for individuals and institutions to reduce allergies, and also to build equitable and accessible health system?
Yeah. Preventing allergies, I wish I could tell you a way we could do that for a holistic individual and institutional approach. We have a general framework of how allergies develop in people, but being able to prevent them from happening is a entirely different question. I think it all comes down to access of care and making sure that the institutions facilitate access of care to providers that can help treat the allergies. Most general providers should be able to take care of allergies, right? And I think we, at least in our group, have done made a concerted effort to try to increase access to care for subspecialty care, but we've also done a lot of education in the community with the community pediatricians and providers to help educate them on what a first line step can be done so that people don't have to wait to see us to deal with their allergies. And having programs like this and others that educate the community on steps that can be taken individually is also really, really important, because even the environmental factors and effects are difficult to implement at the individual level sometimes, but they are effective. Having those filters, keeping the windows closed, just limiting exposure. anytime you can limit exposure or minimize exposure to allergens is going to make the symptoms less. Yeah.
All right, thank you for your answer. I think those are the two questions I have for you. So I don't know if there's any question from the chat room. Okay, cool. So the record the webinar is being recorded, so we have it on our cloud. So we're going to send it after the presentation. Also, it's going to be on our website too for this series. So you can just get connected and join us to get a copy of it. So moving forward, next slide. All right, as next step, so what are those strategies we can use as individual and also as as institution? So as Dr. Mike has said, so we have individual level, we have government level. And just to reiterate on what he has said, so as individual adopt indoor plant and also an air purifier, install indoor air monitoring system, as he has said, and avoid parks, especially during the peak hours for the allergens times. And during driving, make sure that you wind up your windows and also making sure that you have a very filtration system in the car. For institutions and monitor and allergens and inform the public about the high levels. Just want to emphasize on what he has said in the presentation. And further, we also green infrastructure, which is government and government institutions should also support green infrastructure initiatives and also fund them, provide incentive to create an efficient building and also develop actions to reduce exposure to toxic air pollutants. So we be wrapping up with this webinar. We have few announcements to make. Next slide. So later today, by between 5 to 8 p.m., please join us at Urban Artifact and with our Food Policy Council. They're going to be having a celebration later today. Please, by 5 p.m., join us. It's going to title on Cultivate and Connect, a celebration of our regional food system. Please join us, register. This is the link. It's going to be posted. Please join us and register later today. On September 30th, later this month, so we have 23 District Network Summit kickoff reception and panel discussion. So it's going to be at the 1819 Innovation Hub between 5 to 8 p.m. Register to also participate in this event. So we also have, by next month, October 30th, 29th, we have a full system circular series, which is like we started about 2-3 times and now, so another series be coming on next month, 29th, which is on greenhouse gas emissions and food waste. So we're going to teach our audience about how to use the calculator that we've developed. And then by next month, 30th, October 30th, so is our next Climate Health Equity webinar series, which is titled Water Quality, Governance, and Health Outcomes. So please join at the same time next month. And we also have, for more information, please visit our website and get to that. You can get involved. Before we end today's call, so we have on the last call we have a feedback. We want to hear feedback from you. So we have a survey which is going to be posted. Please help us to fill a survey to express your experience about how you and our webinar goes today. Or if you have been our usual participant or attendee, we also want to hear feedback from you. Please try to fill the survey. It's just a brief question that you're going to be filling. Thank you again for joining us today, and see you next month on another exciting topic. Thank you.